Good morning, everyone, and welcome to Virtual Path Day for October 28th. And we're here to meet the faculty of Health and Health Administration. We're going to start this session with a little video about this pathway.
You care about the well-being of others. You want them to live healthy, be free from pain, and heal them if they are afflicted. Helping others to be their best selves and maximize their potential invigorates you. Whether it's nursing, dental health, sonography, massage, radiography, imaging, phlebotomy, physical therapy, or another health career, you will find your vocation in the Health and Health Administration path.
All right, great. All right, we're going to start with some interview questions, and those of you in attendance will have some time at the end of that to ask any questions you may have as well. Right, and we'll start with you, Professor Johnson. Thank you for being here. If you could let us know who you are and what courses you teach.
Are you talking to me? I'm sorry.
Yes, go right ahead.
Good afternoon, everyone. My name is Maddie Josephs. I am chair of the Allied Health Department. In the Allied Health Department, which is part of the Health Pathways, of course, we have 9 programs, 5 degree programs and 4 certificate programs. And I am personally the director for the Medical Laboratory Technology program. I am a medical laboratory scientist, and that is my background. And so I teach courses in that program as well. So I'm department chair for 9 programs. I direct 2 and I teach in 1. And I teach courses like bacteriology and clinical microbiology. I've been at the college for several years, and we're looking to grow our enrollment in these programs because there is a critical need for in many of these fields, including medical laboratory technology and histotechnology. So while I direct the histotechnology program, I do not teach in that program, but my educational coordinator, Professor Tavares-Proulx, Rosemary Tavares-Proulx, is on the call with us as well. And she is a histotechnologist. So I'm going to pass that along to her to introduce herself. Rose?
Hi, so I am the educational coordinator for the histotechnician program at the college. Besides teaching the program, I also work in one of the area hospitals as a supervisor of anatomic pathology. By trade, I am also a cytotechnologist, so I spent the majority of my career working in anatomical pathology, but have also worked in clinical pathology as well as research laboratories.
Great, thank you both. You mentioned, Professor Josephs, that your courses that you teach are part of the histotechnician program. Do you teach courses that are part of any other programs as well?
So the courses that I teach are part of the Medical Laboratory Technology program.
Thank you for that.
Because Rose is the expert histotechnologist and I am a medical laboratory scientist. So what is the difference? One is the histotechnologist works mainly with tissues, tissues from biopsy or from anything that's removed, any surgery, where the medical laboratory scientist or the medical laboratory technologist works with blood and body fluids. So whenever you go to the lab to get some blood work done, that blood goes to, is taken by a phlebotomist, and we have that program as well, and it goes to the laboratory for analysis. And then those results are released to your physician, and that's how your physician knows how to make a diagnosis and knows how to treat you. For a histotechnician, if you have something removed, if you have your gallbladder removed or your tonsils, those tissues go to the histology lab, And that's where they're processed and cut and mounted and stained. And a pathologist looks at them just to ensure that that tissue is normal, healthy tissue. So I do teach in the medical laboratory technology program. I teach bacteriology, which, microbiology. So if you have an infectious disease, those people make that determination what that organism is.
Thank you. And Rose, you said that the classes you teach are part of the histotechnician program. Is that right?
Correct.
Great.
So the histotechnician is a 2-year program. It involves 5 courses over the 2 years, which I teach all 5 of those courses. There's also, besides the classroom portion, there is a clinical portion where the students will go to a hospital and work in a hospital setting and really get their hands-on training. Where in the classroom we deal a lot of the foundational materials of how tissue is processed, what goes on during the processing, how to cut a tissue, how to troubleshoot issues with microtomy, which is cutting the tissue, as well as the different staining techniques.
Thank you very much for that description. Professor Josephs, what drew you to this field? How did you get involved?
I knew in the 8th grade that I wanted to be a medical laboratory scientist, believe it or not. And I went to school. I majored in medical laboratory science. And eventually I worked in a hospital in a laboratory, and eventually continued my education and started teaching. And I discovered that I loved teaching because I was working as a clinical instructor for students who were doing their internship. And I loved that aspect of teaching. So to be able to combine my love for this profession with teaching was just wonderful for me. And I've been teaching here for between part-time and full-time for over 30 years.
Wow. Well, thank you for being such an integral part of CCRI and our programs. Professor Prue, how about you? How did you get involved with your career field?
I have always loved the sciences, went to school, was a biology major, wasn't sure really what I wanted to do in the lab. At the time, St. Joseph's Hospital had a cytology program. I went there because I loved doing microscopy. And just through various opportunities, through different careers, I've worked in different labs. And one of the research labs that I was working at Rhode Island Hospital, they had a microtome in the lab. That wasn't why they hired me. And I learned histology there. And I really fell in love with staining the sections, cutting them, as well as, viewing them microscopically. Then the hospital I was working at, the clinical site for the program, one of the clinical instructors was like, I think you'd be great at teaching, because I was working with Brown students all the time and training them. And that led to me applying for the job at the college. I've been there 10+ years. I love working in labs. I love sharing, what I do in the lab with others. So it's kind of a natural fit.
So if I can just say this one thing, of all the health care fields that are out there, including everything that we have in allied health, in nursing, in rehab health, and in dental health, these 2 professions, both medical laboratory technology and histotechnology, these are the 2 health professions where these professionals have virtually no patient contact. We don't ever see the patient. The patient never comes into the clinical laboratory or the histo laboratory because they just don't. There's nothing for them to do there. And so I always tell prospective students that if you love science, you love the healthcare, you would like a healthcare career, but you really don't want that patient contact, but you want to do that technological part, then both of these professions, which again, we have critical shortages throughout the entire country in both of these professions would be ideal. They're both very much hands-on, very technical, very science-based, and both very integral parts of the healthcare system, because a physician cannot make a diagnosis of diabetes or cancer without the lab and without the clinical lab and the anatomical histology lab.
Thank you for that information as well, because I think it's important. Most students, most prospective students, when they think about health and health administration, even the allied health fields, they think of the patient contact roles, nursing, dental hygiene, and those. So it's important for students to have those options and be able to explore and know that they don't have to fit into one category or fit into certain characteristics
Exactly.
to be part of this area as well.
Exactly, yeah.
Which brings us to my next question. What attributes do students who are successful in your courses or programs share, if not that love of contacting patients personally?
Liking science, liking technology, and paying attention to detail, because this is all very detail oriented. And accuracy in both programs is extremely important. So being present, paying attention to that fine detail. Again, a patient's life is depending on it. Just because the patient doesn't see us, it doesn't mean that we're any less important. And so I would say the love of sciences and technology, and be working with your hands and paying attention to detail. I don't know if Rose wants to add anything to that.
I mean, very similar things. Definitely the attention to detail. What we do is so critical to the patient diagnosis and how they're going to be treated, cared for. So it's a valued part of the healthcare system, without the patient contact. So everything is very number driven, paying attention to the whole workflow, because to get results out of a histology lab, numerous people touch the same specimen doing different aspects of the job. So you really have to be very focused on what you're doing. Histology is still a very manual profession. So you have to have that eye-hand coordination, dexterity, and love to be doing something hands-on. There's a microscopic part of the job, not as much as cytology, but there is some of that. So in histology, you need to, possess different diverse skills, but this willingness to want to learn. It's still a very growing field, so that a love of wanting to kind of continue your knowledge of what you do is important.
Thank you both for that. I know that we have at least one student who is very interested in histology with us today. But at this point, I'd like to open up to all the students who are with us, see if you have any questions for our professors who are here, or any other questions about the pathway. I can certainly direct you to folks as well. But feel free to take yourself off of mute or go ahead and type in the chat box. You have any
I can answer questions about the other programs in the Allied Health Department that include radiography, respiratory therapy, diagnostic medical sonography, and then of course MLT and the medical lab technology and histotechnology. And then the certificate programs include phlebotomy, renal dialysis tech, And then the MRI and CT programs those are only for students who already have they're registered radiographers. So they've already gone through the radiography program, and then they can also get into the certificate programs for CT and MRI.
Thank you. And again, if any students have any questions, feel free to take yourselves off mute or type it in the chat box. I know we just had one student, Julissa, join us. So we are here with Professor Josephs and Professor Tavares-Proulx, who are from different programs, the MLT program for Dr. Josephs and the histotechnology program for Dr. Tavares-Proulx. So please do let us know if you have any questions. And this is always the toughest part of these sessions when we're remote, is waiting for folks to type in that chat, because we don't get those little dots like sometimes you do with texts.
Or you can unmute yourself and go ahead
Sure.
and just ask.
I have a question. Can you
Hi,
hear me?
Melissa. We can. Go right ahead.
Thank you so much for your time today. I know you're all busy, and I sure appreciate the holistic view and to see Maddie in person. I just wanted to, I know everything with COVID is a moving target, and I know that CCRI will be online for the next semester, remote, excuse me. And I just wondered if clinicals are still going to, how likely it is that clinicals will still be available as an option for coming semesters with
You know, I wish I could see the future. And know that our hospitals are still going to be open to allow our students to come in. Unfortunately, I don't know that for certain right now. They are allowing, for the most part, they are allowing students in for clinical. The thing about both laboratory programs is that, again, we don't have any patient contact. So, but it's just another body in the hospital, and another way to have an exposure. But right now, the plan is to offer all lecture online. I am trying to arrange it to get some of the, we can do some labs on campus, so I'm trying to switch some schedules around to allow the histotech students to be on campus as well for a laboratory session in the spring. And the plan is to move forward with clinicals for the spring. But again, we have to wait and see what happens with our surge, which is happening right now, and how we can mitigate any issues with that.
Thank you so much.
Thank you. And we also have another question in the chat. Is it possible to double major in both medical lab tech and histotech?
So it is possible, but difficult. So the histo courses that are typically on campus are in the evening, and none of the medical lab courses are in the evening. So in terms of being on campus and doing your labs, yes, it's an ambitious schedule, but it is possible. The only issue comes with our clinical rotations, because all the clinical rotations, whether in the histo program or the CLT program, MLT program, are during the day. And so in the first semester for both programs, there's no clinical portion, no clinical rotation. In the second semester, if you're a full-time student in the MLT program, you're here every single day. You have classes and labs every single day, and you would need 1 day a week to do your histology clinical rotation during the day. So you could do a part-time MLT program and a full-time histotech program. But again, that would be very ambitious. You would think that because they're both laboratory programs, a lot of the information crosses over. But again, one is clinical and one is anatomical pathology. And the gen eds are pretty much the same. So you can satisfy all your gen eds at the same time. But it is, you know, it would be difficult to do both unless you did one on a part-time basis.
Thank you. And we have a question from Julissa as well. And she says, I'm interested in DSMD. Is that difficult?
So it is. All of these, and I have to say, all of these degree programs are quite rigorous. With the diagnostic medical ultrasound program, diagnostic sonography program, it is most difficult to get into the program because it is extremely, extremely competitive. They only take between 18 and 21 students every year into their cohort, and that is because of the number of clinical sites that we have. So we can only accept a certain number of students because we only have a certain number of clinical sites to send them to. So when we only can accept 18 to 21 students every year and we have 75 to 80 applying, it becomes extremely competitive to get into the program. And as you know, this is a performance-based application process. And so we rely on grades, the grades for the prerequisites, GPA, test scores, all of that factors into and you earn a certain number of points. And we take the top 18 to 21 students.
Thank you. That's important to know. You know, again, a lot of folks think about how competitive nursing and dental is, but any of our programs that involve clinicals, I imagine, are in similar situations. Unless, and actually, nursing, there's probably more availability of clinical sites than some of these other more specialized medical science.
I will tell you that over the past several years, we've been, sonography never has a problem filling. I will tell you radiography never has a problem filling, but programs like respiratory therapy, medical lab technology, and histotechnology, I think because people just don't understand what some of these professions are. Everybody knows what nursing, you know, nurses do, but many prospective students don't really understand what some of these professions are. And so it is, we have room. We have room in these professions. And as I said, for both MLT and histotechnology, if we look at the wage and vacancy surveys that we do across the country, we have a lot of vacancies and you make some pretty good money.
That's also very good to hear.
Yes.
And as time goes on, especially right now during a pandemic, yeah, everyone knows that, you know, patient contact and direct patient care is important, but it is folks in the labs. It is folks, you know, doing these diagnostics that are diagnosing or providing doctors with the information they need to diagnose with COVID or other things that are prevalent this time of year and this year.
Absolutely. You know, they call these where you go to get your test collected, testing centers. They're not really testing centers because testing occurs in the laboratory. What you're going to is a collection center. And the testing occurs by medical laboratory professionals who are educated and have the credentials, because you do take for both of these programs, you do take a national certification exam and you become credentialed nationwide in this field.
Right. And Julissa joined us a little later in this session. Could one of you please go through the difference between medical lab technician and histotechnology again, please?
Sure. Rose, you want to talk about histotechnology?
Sure. So histotechnology is part of the anatomical pathology department. So what sets us apart from the other hospital laboratories is that we deal with tissue that's been removed from the body. So for testing to occur, the tissue has to be handled in a specific way, which allows the histotechnician to be able to cut the slides, stain the slides, so that the pathologist can get a diagnosis. So we cut an initial round of slides, but sometimes the pathologist needs extra special stains or stains that we refer to as immunohistochemistry to do additional testing to help them get a diagnosis. So it's very hands-on. Automation is coming more and more into the profession, but it's still one where the majority of your day you are going to manually, be doing a process and not really putting it on an instrument and having, test results generated from that.
Thank you very much. I just want to see, we have just a moment left, give you a chance, Professor Josephs, to explain your area once again, but then also see if there's any more questions in the room.
So again, I am chair of the Allied Health Department, and in the Allied Health Department, we have 5 degree programs and 4 certificate programs currently. And all the programs require some sort of clinical internship, and all the degree programs require a national certification exam, board exam that you take and become credentialed. In some instances, you also have to become licensed by the state in which you're working. And they are all associate, so they're 2-year programs. They all have to be done on a full-time basis, except for the MLT program. I do allow students to go through on a part-time basis. And I don't know if there's anything else that I can answer for anybody. I'm going to put my email address in the chat, if that's okay.
Yes, please.
And if you have any questions, if you think about anything, you can certainly send me an email. I won't give you my office phone number because I'm not here all the time. I'm here today, but I'm not here all the time. So that is my email address, and feel free if you have any questions about any of the allied health programs. Allied health is everything but nursing, okay? And so again, the 2 programs that I direct are programs that don't have any patient contact at all. And if what you want is patient contact, then you don't want the laboratory programs. You don't want MLT or histotech.
And just for the sake of the recording, I just want to speak your email address because I found if we put it in the description of a video that is linked through YouTube, you'll get spam from that. So
oh, I see. Okay.
Yes. So and the chat doesn't come along with the recording. So so if you would like to reach Maddie Josephs, it's mjosephs@ccri.edu.
And if you have a question specifically about histotechnology that I cannot answer, I will forward that email to Rose Tavares-Proulx, and she'll be happy to reach out to you.
And also at 3:45 today, you can learn more specifics about the histotechnology program at CCRI and more details about what someone in that field does every day and what their job entails. But we are out of time for this session. I want to thank both Maddie Josephs and Rose Tavares-Proulx for being with us today. And thank you, students, for being with us as well. I hope you join us for some later sessions, or that you check out some of the recordings of other sessions in the virtual on-demand library as well. I hope everyone has a great day, and thanks for joining us.
Thank you, Jess. Thank you all. Good luck to you.